Compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, anakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Good morning. Thank you for joining us yet on another episode of Health Talk Show with me, Maureen Kimani, a program brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital. Well, today we shall be talking about a gallstone, or you can call them Cholelithiasis. And in the studio we have a guest from St. Mary's Mission Hospital who will be telling us more about these gallstones. What are some of the risk factors, some of the signs, some of the signs and symptoms, and can it be deadly? Because I'm just going to give you a research about the data in the United States of America that about 1 million people are diagnosed with these gallstones, of which 25% of women are at the age of 60, and as many as 50% are at the age of 75. Well, we shall get to know more about this, and if you want to be a part of this conversation, you can text us on 0717-424-866, or you can use our SMS number, that is 21760. Good morning and welcome to the discussion. Hello.
Hello.
How are you?
I'm fine. How are you?
I'm fine, thank you. Good to see you, and thank you for joining us on our Health Talk Show.
Thank you for having me.
Yes, so because it's the first time you're here in our studio, it's good you introduce yourself to our viewers, tell them what you do in St. Mary's Mission Hospital too.
Okay, Adhiambo Charity. I'm a clinical officer intern in St. Mary's Mission Hospital, currently in my last rotation in the surgical department. Yes.
Thank you so much, Charity. It's good having you here. Well, let's just get started on these gallstones. We have seen that you can also call them cholelithiasis, right?
Yeah.
Tell us, what are they?
From the name gallstones, cholelithiasis tends to be a little bit difficult. It's more medically inclined. Gallstones is just stones blocking the biliary tree, the gallbladder. A gallbladder is actually an organ in the body that tends to provide, to secrete, to produce bile, and it actually stores it. The production is from the liver, and the gallbladder stores it. So because it stores it, sometimes when we have stasis, like when we have the bile flow is interfered with, so we have stasis, we can have stones forming, interfering with the flow, so obstructing the flow of bile into the intestines. So that is essentially what gallstones are. It's just stones forming in the biliary tree, in the flow of the bile from the liver.
Okay.
Yes.
And from the word itself, it's gallstones. We can see there's a part of the stones. Maybe you can just give us maybe a picture of how they look like.
Gallstones, just from the stones, they actually do feel like marble-like, and they can actually be formed by either cholesterol. We can have cholesterol gallstones, or we can have mixed type of gallstones. So essentially, it is when the bile is being produced by the liver, it is transported into the gallbladder where it is stored. So if we have stasis, if we have it collecting there for longer, and we can actually have precipitation of some of the cholesterol, and when it settles, it forms a stone. So essentially, it is just a component of the bile that precipitate to form a stone. Yeah, so that is essentially it. Yes.
Thank you so much, Charity. And who typically gets these gallstones?
Gallstones, mostly females. We've seen it in mostly female and of reproductive age. So there is a mnemonic that we have to, that actually tries to explain the risk factors involved. It's a female gender mostly. Patients who have actually had infections that cause a high bile turnover, like malaria. Malaria can actually predispose you to getting gallstones, because we have high bile production because of rupture of red cells. Alcoholics are also at risk of getting gallstones because they predispose the liver to high fatty content, what we call a fatty liver. So the moment you actually in that state, we can have high cholesterol in the blood, and you're predisposed to getting the gallstones, because as I've mentioned before, one of the stones that we form is actually cholesterol stones. We also have pregnancy, patients who are pregnant or ladies who are pregnant, because they have high estrogen to try and maintain the pregnancy, it predisposes them to actually forming these stones because of high cholesterol level in the body. But essentially we see it mostly in females because our hormones already puts us at risk of high cholesterol than men. Yes.
Okay, and what's the age preference?
40s, we've seen most, like when you started out, you said in the United States of America, 50 and 70.
60, that is 25%, and then by the age of 75, we have 50%.
So essentially in Kenya, we're seeing it a lot in 40 years, female, and maybe 30, 40, 50 years. But there's a very high prevalence in 40s because I think that is a time when our fertility is a little bit high, and also sedentary lives. You know, like now this is not a lady who is actually up and running, so you tend to have a lot of cholesterol. Also our diet predisposes us to that, but essentially we see most women in 40s who actually show up with gallstones. Yeah.
Okay, and can they be genetic?
Not really. No, not really. I don't think there's any genetic predisposition to getting gallstones. No.
All right. Now, let's talk about the risk factors of these gallstones. Maybe you can mention, because you've seen that the women are more predisposed to having these gallstones. Yes. And maybe for the men, you can just mention a few.
Because it's highly seen in females, and I think I've mentioned it's because of high estrogen in our blood. And by the mere fact that we're females, it's a female hormone. So being a female is a risk factor, being in your 40s is a risk factor, fertility is a risk factor because we've seen also pregnancy predisposes you to such. Initially we used to say fair people, like mostly people in the United States, but we're seeing a higher trend in Africa, and that is, I think with the new research it goes to say that we are going more towards a sedentary life, like our people in the United States as compared to in the past. Also infections, like I've mentioned, malaria, where we have high turnovers. If like patients in malaria endemic zones are at risk factor. Alcoholics are actually at a very high risk factors, and we have individuals who have prolonged fasting periods actually at risk factors. So anything that can predispose to high cholesterol content in the blood, or high bile turnover, or stasis of the bile, that is you're actually put at a risk of getting gallstones. Yeah.
Okay, and let me just take you back on the research that I just mentioned in America. In most of the cases that are just reported, they have no symptoms. Now, let's talk about what are some of these signs and symptoms of these gallstones.
Yeah, actually that is a very true statement. Most people have gallstones and they don't know. Actually, almost 60% of our population has gallstones, but they are asymptomatic. What we mean is they do not have any symptom. But now when they become problematic, that is when we now start to develop symptoms. The symptoms will come essentially severe abdominal pain, especially in the right upper part of the abdomen, which we actually call the right upper quadrant of the abdomen. That is where the liver is, because it's just the gallbladder is just posterior, it's just below the liver. So the patient will tell you they actually have severe pain that is experienced 30 minutes after feeding. And the other thing is we have a shooting pain to the shoulder on the same side, or sometimes it radiates to the back on the same side. If it is so severe, the patient can actually start to develop vomiting, and most of the time they'll describe it as green, and some can have diarrhea. That is because of poor digestion of fats, because bile is supposed to digest fats. So if we don't digest fats, you'll have diarrhea, which we call loose motions, that actually don't tend to be flushed. If you're using the toilets, you can't be able to flush it. because of high fat content in your stool. So essentially that is what they present with, but now when it complicates, it comes in just a myriad of symptoms based on the complication that we have developed. Yes.
So does it mean that when you have these gallstones, because at first there are no symptoms, they're not painful, or until they get severe, that's when you start experiencing this pain?
So just to mention something, the pathway for the bile is usually about 1 centimeter, 5 to 9 millimeter thereabout. But if we have a stone that is greater than 9 millimeter, then that is when it's big enough to cause an obstruction, so you'll have symptoms. But the patients, the reason I say almost 60% of the population do have gallstones but are symptomatic is because they are very small to not even cause an obstruction. So it doesn't really cause any problem, and it doesn't really need any treatment. Yes.
Okay, and because you are a clinical officer in St. Mary's Mission Hospital, tell us some of how is your experience there with some of the patients that have just come, and then you just told them, you just said, yeah, you have these gallstones. What's your experience and from the patient side?
Okay, we have been seeing an upward trend in gallstones. That's why I felt this should be a topic to be discussed. We're getting a lot of patients who've been chronically on treatment for ulcers. That's how we understand it. Because of the pain tend to be similar. The pain presenting gallstones and ulcers tend to be very similar. So most of our patients out there, most of the population, the general public walk out there being treated for ulcers. Yeah, being treated for ulcers, getting omeprazole here and there, purchasing them over the counter, but the pain keeps coming in, you know, and just some painkillers. So ideally, what we have been able to find, when you do tell a patient that, you know, all this time you've not had ulcers, what you've had is a stone that is big enough, it's causing symptoms that need to be removed. 50% of them are okay. They're okay with the procedure done. They're okay with the treatment. But of course, there is also the 50% that actually are more hesitant towards going in for surgery. So we have to do a little bit of convincing, and we have to give them time to think about it. Yes.
So you're saying that higher chances you can have ulcers at the same time you can have these gallstones?
Yes, but there's also higher chances that your ulcers is not really an ulcer. It's a gallstone.
Something else.
Yes.
Wow, quite interesting. So as you mentioned about that, apart from maybe monitoring the signs and symptoms, how can you be able to tell that it's true that you have gallstones? Because you have just mentioned about you can have these ulcers, but yet it's not the ulcer, it's gallstone.
I think you should go to a hospital, if especially you've been on treatment for ulcers. I think the only way we can be able to manage or actually diagnose ulcers is a procedure we do by endoscopy. So if it has not been diagnosed by endoscopy, I think you're not qualified to be diagnosed or to be a patient of ulcers. But for gallstones, we only diagnose it with a very simple test, which is abdominal ultrasound, which is able to pick the gallstones. And unfortunately, some of our imaging modalities that we have out there are not able to pick gallstones, especially a CT scan. Someone would think a CT scan is one of the superior imaging that we have currently in the medical field. It should be able to pick it. But unfortunately, ultrasound tends to be a little bit better in visualizing the stones than a CT scan. But CT scan can have some features suggestive of a possible stone. So those are the two imaging, plus your clinical presentation. Yes.
All right. And can you have these gallbladder attacks without having gallstones?
Yeah. You can.
You can?
Yeah, you can. It's a whole system on its own. So there is so much pathologies that can go on in there, minus just having stones. You can have an inflammation that is an infection of that system. and it's what we call cholecystitis, where we have an infection of the biliary tree. The difference between a patient with cholecystitis and cholelithiasis, that is gallstones, will be the pain in the inflammation. We're having something that is constant. The pain is constant. It's with you the whole day, and the patient is very uncomfortable, very sick, because we are having an infection going on. But for gallstones, because it's just a stone, we're not having an infection, then you'll just have the episodic pain, especially after feeding. And unless we have now developed an infection, the pain should not be constant. But here we have a lot of pathologies affecting the biliary tree other than gallstones.
All right. And I think with that, Charity, we're going to take a very short break, and then when we come back, we shall talk about some of the tests that are done, the treatment, and if there's some of the ways you can do to prevent having these gallstones, of which are the healthy diets, habits. Yeah, must be, because you, sorry about that, because you talked about the sedentary lifestyle.
Yeah.
Okay, we're taking a very short break on our health talk show right here at Capuchin TV. We'll be back after this. Stay tuned.
That was my phone.
Wait.
Capuchin TV, your Catholic broadcasting ministry. St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity. And in case you are joining us right now, we are discussing about Gallstones, and in the studio we have a guest that is Charity Adhiambo from St. Mary's Mission Hospital, who is a clinical officer, and we've just been talking about some of the risk factors. We have some of the signs and symptoms, of which some include the sedentary lifestyles, of which every disease that is found by a doctor, we have to be careful on these sedentary lifestyles. Some of us, they don't even exercise, we don't eat healthy, our healthy habits are very poor, of which that's why we have her in the studio, and we shall be discussing more about this. Welcome back.
Thank you.
Yeah, now let's continue about these gallstones. Tell us the process of the treatment.
Most of the gallstones do not tend to cause any symptoms, do not tend to cause any problems. So ideally, most of that, if it is not symptomatic, if it is not problematic, we don't really need treatment for it. You can actually go through your entire lifetime with the gallstone. As long as it's not causing any trouble, there will be no need for treatment. But the ones that are large enough to cause problems are the ones that warrant treatment, and currently we have operations done. We can have an operation to remove the gallstone, to also remove the gallbladder, which we actually call cholecystectomy. It can be done as an open cholecystectomy where we cut to remove the stone, or it can be done by laparoscopically, where we have some cameras going in, just some tiny incisions, and then we remove the gallstone. And dependent on where the gallstone is, some of our patients, we have a procedure that can be done endoscopically, where we have them an endoscopy done to try and remove and decompress the biliary tree, and also as well remove the stone. So ideally, those are the 3 operations that exist in management of gallstones that are symptomatic. Yeah. And
can a blood test detect gallstones?
We don't really have a specific blood test to tell us that, we have a gallstone here. But because of of the impaction of the gallstone in our biliary tree in the liver, it can actually cause some issues that we can detect in the blood. The first thing, it can cause some sort of liver failure. If it is so severe, we do a liver function test where we see if our liver function is still okay. Because if you're having the gallstone blocking the bile flow, the only way it will have to go is to go back to where it came from, and that is from the liver. So there is a lot of congestion in the liver, and it starts to complain. That is where we have the liver function done. So ideally, most of the time, we do liver function to see if we're having any problems coming from the liver. We can do just a screening test to see if there's an active infection going on in the liver, because as I've mentioned, a gallstone is not just the only thing that can affect the gallbladder. There are other myriad of issues that can be happening. Of course, we do our kidney function test to see if it is okay. And we do I'll call it a lipid profile test because of cholesterol levels in the blood. So all these are just screening tests, but there is none in particular that tells us truly we're having a gallstone here. And as I've said before, the only test that we can do is an ultrasound or a CT scan, or sometimes an MRI, but I don't think it gets there really. Yeah.
And tell us the process that is done after a patient is diagnosed with this gallstone in terms of the medication. How long are they supposed to take this medication in terms of coming to have the clinics? After how long of these, after what duration that is?
Okay, so for patients who've been diagnosed with gallstones, if it is asymptomatic, that is going to be something that you'll just find incidentally. Maybe a patient comes with some other problem, and I happen to do an ultrasound and I find it there, oops, you're here, there's a gallstone here, but it's not really causing any issues. So that is a patient who can just be put on follow-up to monitor the progress of the gallstone and the liver function test. But really, we don't really need, it's not done aggressively because we're not expecting it to cause problems. But there is a chance that it may start to be problematic at some point. For the patients who now have the symptomatic part where they're now complaining of the gallstones, those are the patients we now have to follow them up. And we put them on our surgical clinic, and they're booked for a surgery depending on how they want it done, because like I've said, there is laparoscopically, and we can do it open, where we just make an incision, remove it, and treat. And then after the gallstone has been removed, there is literally no need for an aggressive follow-up again, because ideally we do remove plus the gallbladder, so we're not expecting a recurrence if the surgery was done well. So the patient will just be discharged maybe day 2 post-operation, and they will be followed up in a week's time, in a month's time, to see how they're progressing, but not essentially out of complication of the operation, but we just want to see how they're faring on. And of course, there's some lifestyle changes that we advise them on, and what to do next, and what to avoid after the surgery.
Okay, talking about the surgery, when is this surgery needed for gallstones?
Surgery is needed for every stone that is more than 5 to 9 millimeter. And any that is causing liver function derangement, that is causing our patient to be sick, that is if we're having it now complicating to, maybe coming up with other complications, which could actually include liver failure in worst case scenarios, in patients who come with pancreatitis because of the stone impacting it. We can actually also have patients coming with what we call an intestinal obstruction. That is when we have it blocking the intestines. We can have fistula formation. So when any patient with a complication as a result of the gallstone will warrant treatment. Yes, and as long as they are complaining and it is symptomatic, it is causing some difficulty to continue with a normal life, then it has to be treated. It has to be taken out. Yes.
So in short, these gallstones can be cured?
They can be cured. It is very curable. Surgery is the mainstay treatment of gallstones. And the good thing about it is that there is no possibility of a recurrence.
Okay.
Yeah.
Okay, that's nice. And tell us some of these complications of gallstones that can affect a patient.
Okay. One of the worst things that can ever happen in a patient with a gallstone is cancer of the bile duct, because we have constant irritation. You know, it's a stone there, sitting there. It's not supposed to be there. So when you're trying to feed, it's supposed to, the bile is supposed to be released into your intestine to help with the digestion. So every time you feed and there is a stone there preventing the bile to flow, we have constant irritation as the body is trying to push it out or out of the way. So this constant erosion can actually predispose a patient to getting a very fatal cancer, which is the cancer of the bile duct. If it goes a little bit lower, when the stone goes a little bit lower and actually blocks our pancreas, we also have some enzymes that our pancreas produces to digest food. So if we block it, we may end up with digestion of the pancreas. So the patient ends with a very fatal pancreatitis, and they develop diabetes out of that. And then we just have other issues coming in, you get. And then when it goes a little bit lower again, we now get what we call intestinal obstruction, food can't pass. So we have a lot of issues. And now we have to go in theater as an emergency to remove the obstruction so that we relieve the intestines. We can have liver failure as a result of that. We can have fistula. Fistula is when now the stone erodes the biliary pathway, so to the point that it goes into the intestine. So it creates a pathway out of the anatomical pathways in the body. So it can actually cause a lot of issues if it is not aggressively treated, if it is large enough and symptomatic.
Okay.
Yes.
And let's move now to the healthy habits. What are some of the types of food that are supposed to be avoided by a patient having these gallstones, and what's the best diet for them to take?
Ideally, high fatty meal is a little bit problematic for the liver, because bile is supposed to digest fatty meals. So if you already have a trigger, like the moment you take fatty meals, the bile, the gallbladder will be triggered to release the bile so that we digest the fat. So you find if you have a stone, it becomes a little bit more painful in fatty meals. But we should avoid junk foods because it raises our cholesterol levels, predisposing us to getting the gallstones. So just the traditional feeds that have been advised by nutritionists time and over. We get a lot of vegetables in our diet, is good. It's high fiber, less cholesterol. It's really good for the health of our gallbladder. And it also eases the tension, especially if you're having the stones. It eases the tension because there's really no enough fat in that meal to digest. So just avoiding high fatty meals will be the way to go for a patient who has gallstones.
And junk.
Yeah, junk. That is the word for it.
All right. And what are some of the myths of these gallstones? Because I understand there's infertility, we have the kidney functions. Are there some other?
Infertility, I feel it's far-fetched. It's really far-fetched. I don't think there is really a way, gallstones, because it's way up in the liver. I don't feel that like there is a particular way it can cause infertility, because I think one of our risk factors for even getting these gallstones is you being fertile.
Exactly. Pregnant.
So pregnancy and infertility, I don't think they should be used in one statement, especially when gallstones is involved. But maybe they're coming from somewhere, because there was a recent study done about laparoscopic management of gallstones. When we're trying to remove the gallstones from the biliary tree, there was a risk factor where we have spilling the gallstones into the abdomen. And obviously they will go where gravity is more, so that is in the lower part of the abdomen. And unfortunately, that is where we also have our reproductive organs. But ideally, it should not be problematic enough to cause an infertility. Maybe it can just cause chronic back pains and chronic abdominal pains, but not really infertility. And for the kidney functions, I think maybe people correlate them because of kidney stones, but kidney stones and gallstones are two different things, and are caused by two different things, and risk factors are way different, because kidney stones we tend to see it more in men than in females.
All right.
Yeah, so really no correlation.
And what's the survival rate?
After surgery, before surgery, if it's not asymptomatic, it won't really interfere with your lifetime. As long as you don't really have any other comorbidities, if you don't have any other issues, you should be able to live your full life without any issues. But if they are causing problems and it's not been treated, then it's going to cause complications that will definitely shorten your lifespan. Like pancreatitis will set you into diabetes, which is another issue we don't want to start dealing with. But if it is treated, let me say we remove it on time without it having caused complication, then it returns you back to your normal lifespan. So cholelithiasis is something that is very manageable and should actually not halt your entire life expectancy. Yeah, if it is well managed. Yes.
All right. And the question that I'm about to ask you, it's quite interesting, because can fasting cause these gallstones? Because there's some who love, especially that we are in a church premises, that is Capuchin is a Catholic TV station. Some people like to fast. Tell us, can it?
Okay, it's not directly, but it is a risk factor to think of it in a way that we see that bile is supposed to be released after feeding. That's why the correlation with ulcers is very similar, because after feeds, 30 minutes after feeds, that's when you start to feel the pain, because now the bile wants to come out to digest whatever you've eaten. But now you find that if you're fasting, you're denying the bile that chance to be released from the gallbladder so that it digests food. But now the liver is constantly producing it. So when we have too much of bile in the gallbladder, we're going to have the precipitation happening. So yeah, there is some chance that you can form gallstones, especially in prolonged fasting. Not just fasting, it has to be prolonged. And it has to be the fasting that is, I think there is a complete fasting where someone goes without food entirely the whole day. Maybe they just take water. But because I've seen this other kind of fasting where people do intermittent fasting or one meal a day. I don't think that causes much problem.
They just skip one meal.
Yeah. So maybe complete fasting can. Yeah.
All right. And as we wind up, maybe you can tell us what are some of the ways that can be done to improve your gallbladder and just to make it happy.
Let's avoid junk. Yeah, let's avoid junk. Let's avoid fatty meal. Because, someone will tell you, I don't eat junk, but they put a lot of oil in their food. Let's avoid sedentary lifestyle, because it predisposes us to getting high cholesterol. Yeah. And unfortunately for us females, we have other risk issues like oral contraceptives. Yeah. So patients with gallstones, we discourage them from that because it tips your cholesterol a little bit higher. Alcohol, of course, we discourage it because it also raises your cholesterol. So when we just avoid that, I think our gallbladder will be happy.
Especially the sedentary lifestyles. People need to
and
do
alcohol.
exercise. And alcohol, sure. All right. And I think as we, maybe you have something to say, your parting shots.
Okay, yes. I think I just want to emphasize that not all abdominal pain is ulcers. If you've been on treatment for long and it's not manageable, be further investigated, because I wouldn't want to meet you at a point where we're now diagnosing you with diabetes because of pancreatitis, which was brought on by gallstones. I would not want to meet you when you're having now cancer of the biliary tree. So if you've been on treatment for long for peptic ulcer disease, please be further investigated and let them rule out gallstone. It could be there somewhere causing all those issues. And yes, you'll find us at St. Mary's. We're there, the surgical team waiting for you.
Okay.
Wish you well.
All right. Thank you so much, Charity Adhiambo, for sharing this topic of gallstones to our viewer and helping them to understand more and to be very careful when it comes to their lifestyles, healthy habits, of which it's very important. Alcohol, all that you have just mentioned. Thank you so much, and may God bless you. And to the team that has been behind the camera, we have Felix Juma, Michael Kibandi, we have Michael Ndegwa, Chris Nderito, and DJ Fredo. Thank you so much, and may God bless you. Wishing you a lovely day. See you next week on our Health Talk Show. My name is Maureen Kimani. Goodbye.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kijenya alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.